Take you back to our top story tonight, and as South Africans wait to hear from President Cyril Ramaphosa at 7 p.m, some will be listening to see if he will address the scandal surrounding the health minister. Zweli Mkhize has denied any personal benefit from a multi-million rand communications contract awarded to Digital Vibes. An internal forensic investigation has already found that deal, first exposed by the Daily Maverick's investigative wing, was irregular. The Special Investigating Unit's report on the matter is yet to be released. Chris Vick is chairperson of COVID Comms. That's a group of communications experts who had volunteered to help government get its coronavirus message across at the start of the pandemic last year. Chris joins us now live to talk more about these latest developments. And Chris, I'll speak to you about the process that you'd followed in offering assistance to government last year. But let's pick up on this first. How much longer can President Ramaphosa and the health minister hold off calls for the minister to either be suspended or that he step aside?
Well, I think it's much more complex than that. I mean, the fact that there's an SIU investigation underway does add a different dynamic to it. Our view is that the right thing for the minister to do is to take special leave until that SIU report has been completed, at which point we'll all have a clearer understanding of who is responsible for what. I mean, at the moment we're basing it on media reports, which seem very well substantiated. But I do think that investigative process has to run its way. And I think the best thing for the minister would be the least to take special leave during that period, as Minister Ndabeni Abrams did when she was caught having lunch during the lockdown.
And when you look at Digital Vibes, you've written a piece on the issue, and yes, the contract has been found by an internal forensic process investigation to have indeed been irregular. Is the issue, I'm basing this on the piece that you've written, is the issue here the astronomical amount spent, or the awarding of the contract itself to people who we are now learning are linked to the minister? He is referring to them as comrades.
I think it's both, Tembekile, but I mean, I think the issue that concerns us the most is it appears that money was wasted. So not only that the procurement process was irregular and that the people involved had very close links to the minister, but at a time like a pandemic, where 56,000 people have died that we know of, and it's probably higher, a lot of those people would have benefited from reliable public health information, which is what Digital Vibes ultimately was supposed to do, and that's the gap. And I think if there's one thing that needs to happen quite quickly, if there is a finding of wrongdoing, that money must be taken back and it must be spent immediately on accurate public health information, because you know as well as I do that people need to know as much as they can about the coronavirus. They need to be empowered to make decisions so that they can avoid being infected and spreading the COVID-19 to other people. That really is the priority right now.
And it was the priority in March last year as well, at the beginning of the pandemic, which is when you, as a group of communications experts, then reached out to government and said, look, we are ready and willing to step in here and help you to get this message of information that was very and still is very scientific, very technical across, but that was not received in the way that you would have hoped it would have been, was it?
Well, there were two approaches in Bikile. One was to the late Minister Jackson Turnbull, who was incredibly supportive. I mean, I can never acknowledge that enough. He said, go for it, brew, and we did, and we pulled together a group initially of 170 volunteers. It's now about 30 to 35 people. We made a similar approach to the health ministry through Tahira Massa, who at the time seems to have been doing Digital Vibes and advising the minister at the same time, and we got blue-ticked. I mean, we essentially didn't get any response at all, which is a great pity, because further down the line, the Department of Health reached out to us, asked us to help and to get our volunteers to work for free to produce public health information, which Digital Vibes should have been doing as part of its brief, as part of its 250 million rand splash.
And how's that progressing now? I mean, many of us at this point are very confused about what is being done by those of you who've been roped in at a later date and what would have been covered under the costing from Digital Vibes. You've gone as far as putting together a list of what could have actually been done based on the amount that's circulating in the media.
Well, we work on low budgets, but I mean, our material is high quality. We could have produced at least 700 video clips and several hundred infographics and paid for the airtime to have them broadcast. I mean, we would have had a 12-month program to literally saturate South Africa with public health information using social media. We rely very extensively on WhatsApp groups. People access information on our website, which is covidcoms.org.za. But we're not alone, and I have to emphasize that. I mean, there are a lot of other civil society organizations who are doing exactly the same thing without government money. There are people in government who, despite the scandal, are still working incredibly hard. The health department team that we interact with are actively producing messaging, as is GCIS. The difficulty is that missing 250 million and the difference that would have made to really get this issue front of mind with everybody, and particularly in our case, people who are what we call information poor, who don't necessarily understand English, they don't understand medical jargon, and they don't understand some of the highfalutin language that comes from government. So that really is the gap that exists, is to try and provide basic information to people who need it the most to survive and to save lives. That really is the ultimate objective. And sadly, it's been undermined by people who saw it as an opportunity to get rich rather than an opportunity to save lives.
And just on the communication by government being undermined, how much do you think this current scandal and the allegations against the minister, proven or not, will likely undermine the seriousness with which the average South African takes whatever is said by government going forward?
Well, I think there's been a trust deficit since day one. And you can see that in the sort of skepticism and cynicism and people ignoring the lockdown regulations. And unfortunately, the PPE scandal made a huge impact on public confidence. The miscommunication, I mean, the ministerial briefings, which hopefully are a thing of the past, didn't help to instill public confidence. And those missteps really do make a difference, not on a sort of emotional level, but purely on a practical level. People starting to think, but can we take it seriously? Is the vaccine rollout program really happening? And because of the sort of inability to fully and totally communicate during this phase, we're particularly worried that trust deficit is going to increase, particularly given some of the difficulties with vaccine procurement, the vaccine processes, and that's not what you need. You need everybody behind this initiative right now. You need everybody to understand the importance of getting a vaccine, social distancing, wearing a mask, and washing their hands, so that as many of us as possible can avoid infection and we can save as many lives as possible.
Chris Vick, Chairperson of COVID Comms, good to speak to you, sir. Thank you.